What is the best medication for motion sickness? If you have ever felt queasy while traveling by train or cruise, you are not alone. Motion sickness can be a real challenge for many travelers. So, what is the best medication for motion sickness? Let's break it down. Motion sickness happens when your brain receives mixed signals about movement from your inner ear, eyes, and body. This can lead to feelings of nausea and discomfort. The good news is that there are effective medications to help manage these symptoms during your travels. Two of the most commonly recommended over-the-counter medications are Dimenhydrinate, often known as Dramamine, and Meclizine, which is also called Bonine. Both of these medications work by blocking the signals in your brain that cause nausea and vomiting. Dimenhydrinate is a popular choice. It usually works for 4 to 6 hours and is best taken before you start feeling sick or at the first sign of nausea. However, one thing to keep in mind is that it can make you feel drowsy. If you plan to enjoy activities during your journey, this might not be the best option for you. There is a non-drowsy version of Dramamine, but many find it less effective for preventing motion sickness. On the other hand, Meclizine tends to cause less drowsiness. It is often preferred by travelers who want to stay alert while enjoying their trip. You typically take it once or twice a day, and while it can cause side effects like dry mouth and mild drowsiness, these are usually less intense than with Dimenhydrinate. If you are looking for an alternative to oral medications, consider Scopolamine patches. These patches are placed behind your ear and can provide relief for up to 3 days. They are effective but may cause side effects such as dry mouth and dizziness. It is important to use scopolamine with caution, especially if you have certain medical conditions, and avoid alcohol while using it. For those who experience severe motion sickness, especially on cruises, there are stronger medications available. Prochlorperazine, which is often given as a suppository, can be administered by a physician on board for intense symptoms like persistent vomiting. When using these medications during rail or cruise travel, here are some practical tips to keep in mind. Take your medication about an hour before your journey or at the first sign of nausea. Avoid alcohol, as it can increase side effects. Plan your activities considering the potential drowsiness from the medication. Additionally, you can combine medication with non-medication strategies. Sit in areas with less motion, such as midship on a ship or facing forward on a train. Focus on the horizon and ensure good ventilation to help ease symptoms. In summary, the best medication for motion sickness during rail and cruise travel depends on your personal needs. Dimenhydrinate is effective but may cause drowsiness, while Meclizine offers a less sedating option. Scopolamine patches provide a convenient alternative. By combining medication with practical travel tips, you can significantly improve your comfort and reduce motion sickness symptoms on your next journey.